Hi there. I wanted to take some time to do a video for all the caregivers out there because you really need to be saluted and celebrated and noticed for the fact that you play a critical role in our success as a Tarlov Cyst disease patient. Um, I'm going to have to break this video up into a couple of videos, basically. Um, First, I want to approach being a caregiver in the surgical situation as far as immediately after surgery and before surgery. But then I also need to approach it as kind of the long-term caregiver responsibilities when we're in the basically 2-year nerve healing process. So first of all, I wanted to talk to you about, some of the things you can do pre-surgery, what your sister's going to face as far as surgery, and the challenges immediately after surgery. So, first of all, you can have two types of caregivers in this situation. Either you are someone that is in your sister's life all the time, like my husband, who is my caregiver, or, you can be a family member or a friend that has volunteered to help with this situation. And each of those situations presents different challenges. If you are someone that is not with your sister in a day-to-day situation, I think it would probably be a good idea to go ahead and sit down with your sister and go through some of the important things, like any co-conditions that they have. For instance, I also have Ehlers-Danlos syndrome, a connective tissue disease. And so, my caregiver needs to be somewhat familiar with that and the challenges that it could bring as far as after surgery complications and that kind of thing. And also for both long-term and long-term caregivers, and if you are a friend and such, I think it's a really good idea if you go ahead and get your sister to discuss all the medications they take and any allergies and interactions that they may have, because common medical errors happen all the time, and there are going to be times when your sister is not able to advocate for themselves, and you're going to be responsible for that kind of stuff. So I think it would be a good idea to go ahead and get those things done first. And also the time leading up to surgery, as far as the emotional battles that most of us face with our decisions, because this decision is the most personal decision that we can ever make. And a truly informed sister also knows that this is really a gamble. Results are not guaranteed. We have things that can go wrong, that we can end up with conditions that are worse and progressive than what we're having surgery for. And so, the time leading up to surgery can be very emotionally charged as far as going back and forth on your decision. So it's important to basically just offer your support in those situations, and also, be supportive if your sister decides that they're just not ready, even if it's at the last minute, because this truly is a commitment to a very large change in their journey. And so, it really needs to be something that they are sure about, because, as a sister, you have to live with the ups and downs of your decisions. So first, I want to talk a little bit about what your sister is actually going to face with surgery. I'm going to be talking about the traditional surgery, which involves basically, your sister has these cysts on their nerve roots that dilate out and compress the nerves and cause, incredible pain and symptoms and numbness. And so the surgeon is going to go in and they're either going to decompress the cyst with their fingers or even cut open the dura and the cyst on the nerve root sheath and fill the hole that's causing that fluid to cause the dilation and sew all that back up and wrap it. And, the nerves are our epicenter for pain and feeling throughout our bodies. And so, this can be an incredibly painful outcome just because at this point in time, after you've had surgery, you've pretty much made the nerves about as angry as they can ever be. And so you can face, pretty significant pain because of that. Surgery typically lasts anywhere from 3 to 5 hours. Depending on your surgeon, my surgeon is Dr. Fagenbaum in Dallas, and I'll tell you that it can be very difficult to get very specific answers to things that were, noticed in surgery and that kind of thing. And so I do recommend that if your sister has any specific questions they want to ask, like, how things looked when they got in there or anything, that you two work together to come up with those questions and ask those questions when he comes out for his update from surgery, because they may be the only chance that you get those answered. Just something to consider. When your sister comes out of surgery, a lot of times the pain can be pretty intense, and so there may be a amount of time where it's going to be a very uncomfortable situation, especially if this is your loved one, the center of your universe, and you're having to watch them go through a lot of pain. So prepare yourself for that and be ready to advocate for your sister as far as pain management, and know the chain of command going in as far as who you need to put pressure on if you feel like your sister is not getting the appropriate pain management that they deserve and need. Your sister will be flat for about 24 hours after surgery. And during that time, I highly recommend, due to the amount of relief it gave me, in trying to keep ice packs on your sister's incision as continuously as possible. You can work with the nurses to actually get access to the freezer where those are kept, and it'll make everyone's life better, because the nurses don't really want to be bringing ice packs all the time. So if you two can work together to get that taken care of, it makes everything easier. Communication is so key to this whole process that you really need to be talking to each other about any needs that your sister has and how you can meet them. And as well, keep an eye on your own stress level and your attitude so that you can maintain basically a level head and not too much anxiety, because it just brings anxiety upon your patient. Whether it requires you taking a walk or taking a break, don't be afraid to take a little bit of time for yourself so that both of you can benefit from you also keeping your stress level down. You'll be in the hospital for 2.5, 3 days, and then depending on if you're traveling, you'll be released to the hotel. And at that time, things should be calming down a little bit. You should be going more into a routine of basically, what is needed and how things are going and progressing. We can be very adept at hiding our pain from the people that we care about, just because we don't want you to worry. So watch for any nonverbal clues as far as that, and keep an eye on that. Try and advocate for your sister to get adequate rest and those type things. Not, in a forceful or nagging way, but some of us, like me, when I came out of surgery, I was in better shape after my surgery than I ever was before surgery. And so my biggest challenge was actually holding myself back. And so my caregiver was my husband, and he had a lot of challenges in trying to maintain a balance of me not basically overdoing it and staying in a normal type of pace. So be aware of that if your sister comes out and they're just in amazing shape, because when we go through that, it's very hard not to just go ahead and celebrate feeling so good. And, our bodies will tell us when we have overdone it. And so, be aware that, our conditions are going to change from day to day, hour to hour, minute to minute. And, it requires a lot of flexibility. But, also remember that, this isn't all about the sister, because you need to be taking care of yourself as well. You're no good to us if you get down yourself as well. So be cognizant of what your needs are, and don't feel guilty if you need to take time for yourself, because this can be very stressful and, sometimes thankless jobs with long hours and low pay. And, I don't think there's many of us out there that don't truly appreciate it, but we may not say it enough. And so, basically we celebrate you because really it is pivotal to our journey that we have you there. And so basically that's all I want to talk about with the immediate time after surgery. And I'm also going to do one for the time after that. So I hope this has been informative. I look forward to your feedback and comments. If there's any specific questions you have, please ask. Thank you and have a blessed night.